testosterone is secreted by. Remember, in a male person, you have to think in the terms of two things. Rest female you will be studying in ops gynae, but male it is concerned with me, right? I will be teaching you. So what is going to happen? We are going to have two cells. We are going to have, whenever I'm going to talk about the male person, I'm going to talk about the Sertoli cells. I'm going to talk about the Leydig cell. I'm going to talk about the Leydig cells and Sertoli cells. What this Leydig cells is going to do, remember, whenever there are formation of testes will be having two things. First is your Leydig cell, second one is your Sertoli cell. This Leydig cell is responsible for the production of what? Testosterone. Under the influence of LH, it is going to make what? Testosterone. And now this testosterone is going to make, if I talk about a baby, this is going to make what? Internal genitalia. Remember, the internal genitalia of a person is concerned with the testosterone. And this internal genitalia is what? It is going to make which duct? This is your anatomy question. It is going to make a duct, that is going to be your Wolffian duct, and this is going to make internal genitalia. So mnemonic is seed, seminal vesicle, ejaculatory duct, epididymis, and vas deferens. So this is going to be your internal genitalia because of testosterone. Now this testosterone is going to convert into dihydrotestosterone with the help of a certain enzyme. What is this particular enzyme? I hope all of you know this. This is going to be your 5-alpha reductase. And this dihydrotestosterone is going to make what? It is going to make, sir, external genitalia. It is going to make external genitalia. So growth of penis, growth of testes, growth of prostate is concerned with what? It is concerned with dihydrotestosterone. It is not concerned with the testosterone, right? This is going to be more potent thing, right? And we are also using 5-alpha reductase inhibitors, right, in the cases of alopecia, right? So what will happen with the Sertoli? Yes, very good, Puneet. It is going to release the most important thing, that is going to be your anti-Mullerian hormone. That you have to remember. Mullerian inhibiting substance or anti-Mullerian hormone is coming from the Sertoli cells. These are known as nurse cells. The important ones I'm talking about, this is going to be responsible for the phagocytosis of the dead sperm cells, right? And it is going to make blood testis barrier. It is going to make blood testis barrier, which is going to have what kind of junctions? Remember, I taught you claudine and occludine tight junctions. In this video itself, I've told you in the part 1. Right? So this is the important things about Sertoli cells. It is going to make anti-Mullerian hormone, which is going to inhibit Mullerian duct, because Mullerian is going to make female organs, right? So Sertoli cells is going to inhibit that female organs. Otherwise, what will happen? The person will be having both male and female organs, right? That you understand, right? Second thing, we are having the function. This is going to be the nurse cells, and it is going to be responsible for the phagocytosis and blood testis barrier, right? This FSH and LH, these are going to be coming from your anterior pituitary. They are going to come from anterior pituitary. Basically, what is happening, let me give you the complete story. What is going to happen? Your brain will be releasing what? Gonadotropin releasing hormone, and this gonadotropin releasing hormone is going to go to the anterior pituitary, and now your anterior pituitary is releasing what? First is your FSH, follicular stimulating hormone, and second one is your luteinizing hormone. It is going to come both in the male and also in the female, both in the male and female. And this GnRH will be having a specific type of release, that is going to be your pulsatile release. Whenever we are having pulsatile release, then it is going to show positive action. It is going to show positive action, right? What about this leptin? What about this leptin? Remember, there is another question based on this leptin. We will be discussing about that, right? So this leptin is going to be responsible for the, it is going to play permissive role in puberty. It is going to play permissive role in puberty, right? So what is going to happen? Let me make you understand. Just give me 2 minutes. So what is going to happen? This leptin is going to responsible for the permissive role in the puberty. It is going to tell us about the adequate fat storage. It is going to tell us about what, Vache? It is going to tell us about the adequate fat storage. So I'm just giving you a simple story. What is going to happen? Suppose there is a 12 or 10-year-old girl Now she is getting fat, she is eating too much of food, she is getting fat. What is going to happen? She will be releasing what? Her body will be having adequate fat storage, and her body will be having adequate fat storage means what? It will be releasing what? Leptin. It will be releasing leptin, and this leptin is going to inhibit a thing that is going to be your kisspeptin. This is going to activate kisspeptin, and this kisspeptin is going to be responsible for the inhibition of GABA. It is going to inhibit GABA, and now what is going to happen? This GABA will be inhibited, and you will be having what? Pulsatile release of GnRH. Pulsatile release of GnRH, and this pulsatile release of GnRH is going to release what? LH and FSH, and this LH and FSH are going to responsible for the puberty. So you must be thinking, normally why we are not having puberty at the age of 5 or 4? These hormones are already present, LH, FSH, and this GnRH is present, but remember, it is not in the pulsatile manner. Whenever it is coming in the pulsatile manner, after sometimes after an interval of like 90 minutes, what is going to happen? This is going to show a positive effect, and this is going to cause puberty. If the baby is more fat, you understand this, if the baby is like a 7-year-old, 6-year or 5-year-old boy, and he is having adequate fat storage because he is eating too much of junk, what is going to happen? He will be fat, he will be having more leptin. More leptin will lead to what? Precocious puberty. This person can have precocious puberty, right? This person can have precocious puberty, and if this particular cycle is not working, that particular person can have delayed puberty as well. You understand this? What is the role of this leptin? This is your previous year question. They ask you what is the function of this leptin. Leptin is going to tell us about the adequate fat storage, not us, but it is going to tell the GnRH, so that it can release the GnRH in pulsatile manner, and you can have puberty, right? So this is how it is happening, right? Let's discuss about the male internal genital organs that we are having. So we are having this particular thing. This is going to be your testes. This is going to be your testes, and testes will be releasing the sperm, and the sperm will be coming to this epididymis for the maturation. This testes will be releasing the sperm will be coming to the epididymis. The sperm formation occurs in the seminiferous tubule. Remember, sperm formation is occurring in the formation. If I talk about the formation, let me write the important questions. The formation is happening at the level of seminiferous tubule. Seminiferous tubule. Right now, this sperm, whenever required, the sperm will be going to this particular epididymis for the maturation. What is the function of epididymis? Epididymis function will be maturation. Epididymis function will be maturation, and after the maturation, the sperm, whenever required, is going to go through the vas deferens. This particular is vas deferens, and it will be going here. It will be going here, and here you are having, this is your bladder. This is going to be your bladder, because sperm and urine in male genital organ, there will be single opening, so both the things will be coming out through urethra. Now the sperm is going to come from the vas deferens, right? We are having two glands. One is your seminal gland, second one is your epididymis. These two glands are going to release their substances. This is going to release the seminal fluid, and this is your prostate, which is also going to release the prostatic fluid, and now everything will be coming out through this, right? This is known as semen. Earlier it was sperm. Sperm is coming from the testes, and when it is mixed with the seminal fluid, it is mixed with the prostatic fluid, it is going to become what? It is going to become semen, right? Semen analysis, there will be question. Semen analysis, there will be question. You will be having tests like Barbeриos, you will be having Florence, right? FMT, very, very important. We'll be discussing about that as well, right? So this is going to be the pathway, complete pathway, and through here the sperm will be going out, and it is going to be responsible for the production of new babies, right? So this is going to be the question, and what is going to be your answer? Testosterone is secreted from which cells? Testosterone is secreted from the Leydig cells. Leydig cells. Wonderful, guys.